Hi, my name is Alexandra Bryant, and this is my VET 122 Abdominal Radiographs video. Lulu Logston is one of our many patients here at Boston Animal Hospital. She presented with abdominal pain and discomfort and vomiting. As a result, the doctor ordered abdominal radiographs. Medical conditions that may lead to abdominal radiographs include lethargy, abnormal urinating or defecating, vomiting, diarrhea, appetite loss, and abdominal pain. Boston Animal Hospital actually has a measurement technique chart, which provides the correct KVP and MAS setting based on the patient's weight and the anatomical area which we are radiographing. This technique chart is super convenient, however, it never hurts to double check and measure the thickest part of your patient's abdomen. Prior to measuring, be sure to place the patient in the position which he or she will be in when actually obtaining the radiographic images. Unlike the extremity radiographs I took in my first video, abdominal radiographs should have low contrast and a long scale, meaning the image will display a plethora of the color gray. If the radiographic image ultimately appears to display more tones of black and white, try adjusting your KVP, then your MAS inversely. Placing the patient in a left lateral position is ideal when the patient is or has been recently vomiting. This is because gas flows toward the pyloric antrion and can possibly reveal a foreign body material. Normally, the liver is beneath the ribs, but the position is affected by the patient's breathing and the type of the species. The margins of the liver are best visualized on a lateral radiographic view. The cranial margin of the liver nearly parallels the borders of the diaphragm and is easy to see. However, the caudal portion is typically hard to see on the VD view. It is optimal to obtain an abdominal radiograph at the end of expiration because this ensures the diaphragm is positioned cranially and isn't compressing the abdominal contents. As the lungs contract and the diaphragm relaxes during expiration, there is maximum amount of space for abdominal contents. When obtaining a lateral abdominal radiograph, be sure to collimate cranially from the caudal aspect of T7 and caudally to the greater trochanter in order to include coxofemoral joints. The central ray should be over the caudal aspect of the 13th rib at the level of L2 to L3 in canines. As for felines, the central ray should be directly over 2 or 3 finger breadths caudal to the 13th rib. Anatomical landmarks to look out for when obtaining a VD abdominal radiograph include the T9 vertebrae, such as the diaphragm, cranially to the greater trochanter, caudally to also show the coxofemoral joints. In canines, the central ray should be ideally centered over the caudal aspect of the 13th rib at L3, around where the umbilicus should be. In felines, the central ray should be centered over 2 to 3 finger breadths caudal to the 13th rib.